Does the gentleman from Georgia seek recognition?
Madam Speaker, I move that the House suspend the rules and pass the bill S. 2554.
The clerk will report the title of the bill.
Senate 2554, an act to ensure that health insurance issuers and group health plans do not prohibit pharmacy providers from providing certain information to enrollees.
Pursuant to the rule, the gentleman from Georgia, Mr. Carter, and the gentleman from New Jersey, Mr. Pallone, each will control 20 minutes. The chair now recognizes the gentleman from Georgia.
Madam Chair, I ask unanimous consent that all members may have 5 legislative days in which to revise and extend their remarks and insert extraneous materials in the record on the bill.
Without objection.
Madam Speaker, I yield myself such time as I may consume.
Gentleman is recognized.
Thank you, Madam Speaker. As the only pharmacist in Congress and a practicing pharmacist for over 30 years, this issue of an industry forcing the American people at the pharmacy counter hits incredibly close to home for me. Pharmacy benefit managers, also known as PBMs, have put forth restrictions that debase the drug supply chain in the United States. PBMs have existed for decades, but they have grown through mergers and acquisitions to be the middleman for much drug coverage on formularies. The hope was that PBMs would reduce administrative burdens and be able to negotiate drug prices. Yet here we are today voting on 2 bills to stop them from intentionally defrauding patients. It's unfortunate that we have even reached the point where there needs to be a law passed that prohibits this type of behavior. I appreciate that we are here today voting to sign these 2 Senate bills, banning gag clauses into law. However, I think these bills could go further. My bill, the Prescription Transparency Act, which was introduced earlier this year, deemed any contract containing gag clauses null and void. Furthermore, it applied to every single insured patient, and it not only ensured that patients were notified of the lowest price, but also of any less expensive generic equivalents that might be available to the patient. My other piece of legislation, the Know the Cost Act, not only bans gag clauses in prescription drug plans for Medicare Advantage, Medicare Part D, individual and group insurance plans, but also informs beneficiaries about the consequences paying out of pocket. My bill received letters of support from the American Medical Association, the American Psychiatric Association, the Global Healthy Living Foundation, the National Association of Chain Drugstores, and Rite Aid, a clearly diverse group of stakeholders, all hoping to lower the price of prescription drugs. States around the country have taken action to address gag clauses, with over 20 states having banned them and countless more considering it. While we have worked through these bills, we've seen the wide-ranging impact it has had. We've even heard in a committee hearing from colleagues like Congresswoman Dingell, who was initially told that her prescription would be $1,300, but then talked to her pharmacist and got an equivalent for $40. I want to repeat that. We've even heard in a committee hearing from colleagues like Congresswoman Dingell, who was initially told that her prescription would be $1,300, but then talked to her pharmacist and got an equivalent for $40. The discrepancy in cost should really be a wake-up call for how formularies are being impacted. Let's get this legislation passed so we can take on the other issues in this space. While I'm pleased that we are taking these important steps toward reining in PBMs and drug costs, I think there is still far more work ahead. Again, Madam Speaker, I want to thank you for including these bills on the legislative calendar for today. I sincerely hope that you take the resounding national support for banning gag clauses in consideration in the future and allow patients to regain control of their medical decisions back from multi-billion-dollar middlemen. I urge all members to support this important legislation and reserve the balance of my time.